Hello, I'm Dr. Carol Lavender, Dean of the School of Nursing and Allied Health at Houston Christian University, and this is another episode of Think About It. I'm here with Blake Swanson, one of our newest faculty members, who also serves as our nursing simulation lab manager. Blake has become an integral part of our team extremely fast, and I'm excited to talk to him today about our simulation lab and his role here at HCU. Blake, would you tell us a little bit about yourself and how you came to HCU?
Sure, yeah. I'm excited to be here, and as you know, I started this summer as the simulation lab manager. And before that, I have several years experience working in an ER setting, and specifically many of those years working in the pediatric ER environment. As far as what brought me here to HCU, a lot of it was through the connections I've made in the nursing community throughout my career, one of which was in a previous education setting where I met you, Dr. Lavender.
That's right.
And what brought me here specifically was the mission of HCU and my personal mission and the alignment that had with bringing young people along and helping them through leadership and mentorship to really grow as who they are as a healthcare provider, who they are as a person, and who they are as a son or daughter of Christ. And having that alignment with HCU and my personal philosophy was something that was really important to me and an opportunity I couldn't pass up.
And that makes you such a great fit for HCU. So we're so thankful for that. Now your role here with us is currently focused on simulation in the simulation lab. For the people tuning in, what is a nursing simulation lab?
Yeah, so there's kind of two different parts with the nursing simulation lab. There's the simulation itself, which is the environment that we create to be as real as we can and as much like the hospital as we can, where the nursing student comes in and they'll be the nurse for that time and provide patient care to a simulated patient or mannequin. Then we also have the skills lab and the lab portion that goes with their coursework, which I like to refer to as kind of a hands-on study hall, where the students will get to come in and practice their skills as a nurse, and they can come in for open lab or as part of their coursework to learn how to do those hands-on skills.
So why is a sim lab important for the nursing students in our program?
I think simulation really helps the students learn how to become the nurse. And I like to refer to it as the socialization as a nurse, where they learn how to interact with the patient, interact with other members of the healthcare team, interact with other nurses. And that's really important because in the clinical setting, they don't always get that opportunity until they're a nurse and licensed themselves. And so it's a great place for them to learn and grow with those hands-on skills in a real environment.
You know, and here at HCU, we love the fact that, you know, they get to grow and learn together. It makes them feel part of belonging to the community at HCU, and it also helps to make them feel part of the community in the healthcare setting. How does simulation work in tandem with the students' experiences out at the clinical sites, where they're actually interacting directly and indirectly with patients?
Yeah, I like that you use the word tandem there because I think that they both complement each other. And I think the important part for simulation is really the student gets a chance to be the nurse. And when they're in a clinical setting, they're still a student that's with a preceptor or with a member of the hospital. But in simulation, that student and their group of students that are in there with them, they're the nurses for that moment. And it really is a chance for them to develop and flourish with what it is to be a nurse, thinking, doing, and acting like a nurse.
So what actually happens during simulation?
Yeah, so simulation actually starts the day before or the night before for some students when they start doing their pre-work assignments. And so the pre-work will start with information that they'll need to know about their patient the next day, whether that's review of medications or pathophysiology or something of that nature to get them ready for their patient. When they arrive for the day of the simulation, we start with a pre-brief, which is myself and the other instructor that's with the class and the students, and we review some of that pre-work, as well as review other things that they may need to know about whatever type of patient they were taking care of that day in our simulation. After the pre-brief, we move into the fun part, or sometimes for the students, the stressful part, which is the simulated patient care. And so they enter the hospital room with the simulated patient, and we go through the scenario that we have scripted out for them. And they get to respond and react as a nurse would, like we talked about. And then it's wrapped up with debrief time, which I think is the most important part of the simulation, where we talk through the situation. The students have a chance to share what they learned, what they did do, what they didn't do, and what they can do better for their future encounters with a patient like this. And that's really where the connection is made between the theory that they're learning in class and the action of what they're doing as a nurse with the hands-on skills.
So, you know, I've had an opportunity to go through and watch the simulation. I love going in the skills lab. I love going and watching the students and their aha moments and things like that. What kind of, can you tell us a little bit more about the kinds of simulations the students experience?
Yeah, I think we're really fortunate here at HCU to have the university supporting us. And over this summer, when I started and into the fall, they've helped us with purchasing some new equipment for our students. And so we have low fidelity and high fidelity mannequins that the students can do simulations on. The low fidelity mannequins we use a lot more with our beginning students at the front end of the program, so that they don't get overwhelmed with some of the features. And so there's things they can do where they would put their stethoscope on and listen to the patient's heart or lungs, and they can do an assessment that is skill appropriate for them at that point. When we get to the high fidelity assessment, or the high fidelity mannequins, the students are able to assess much more, and they're able to interact with the mannequin much more as they see some of the things that the mannequin can do. And this is really my favorite part, to see some of the shock in the students' eyes when the mannequin will blink or the chest will move up and down when the mannequin breathes, and some really interesting things, but it really adds to the realism of the situation and the realism that the student is getting to participate in as the nurse.
You know, when you say realism, as a nurse, we're both nurses, so the reality is there are times when our patients don't have good outcomes. And so how does simulation help the student prepare for that?
Yeah, I mentioned a moment ago that we have a script that we'll go through, and that's really more of a guide for how the scenario could go. But as long as we're hitting the objectives for what the simulation is supposed to cover for the students, I really allow the scenario to unfold as it would for a real patient. And so there's just as much learning in a simulation where the patient doesn't do as well clinically as they would if a student made all the right decisions and performed everything correctly. And that's really where the debrief comes in, because we can see how there's consequences for actions, and we can see how you know, the choices that we would make as a nurse can either improve or deteriorate the patient's situation.
It's a great safe place, right?
Yeah,
to learn.
and that's what we like to say about simulation. It's a safe place to learn, where, you know, nobody gets harmed and nobody dies, but we can all have a great learning experience from it.
And just as I go through the lab during the week, we see really a lot of our fundamental students, our brand new level 1 students. They spend a lot of time in the lab, don't they?
Yes,
Blake?
yeah.
And it's so much fun to watch them and to picture how they are going to act in, when they get into the clinical setting. What is the best part about simulation?
For me, the best part of simulation is when the students get to have that, what we call a light bulb moment. And you mentioned the first semester students, and getting to work with them all the way through their program is something that I'm looking forward to, where we see them develop from just a student starting out brand new into a novice professional nurse, and getting an opportunity to watch them put the theoretical things that they're learning in class into action. And I talk about that a lot in debrief, from knowledge to action. And it may seem simple to somebody who's never been in this situation, to move into action with something you know. But you can ask any one of my students and they'll probably tell you different, that sometimes it's hard, and it's hard to make that jump to doing what you know you should do or doing what you've read. And that's a big adjustment for a student nurse to move toward when they can move and act on those critical thinking skills that we're helping them develop.
You spoke about critical thinking, and one of the critical thinking and clinical judgment is, those are terms that we use from the very beginning of nursing school. And so our hope and the ultimate outcome for our students is to be able to pass the licensure exam. And so all of these things are helping with their clinical judgment and their critical thinking. I know that I had the opportunity to observe last week with our level 4 students. Yeah. Those are our graduating seniors. And I was incredibly proud to see that. I believe you said the patient, you had not planned for the patient to have a good outcome, but they did so well in their assessments and their interventions that you felt like it was, it was okay that the patient had a good outcome.
Yes, and speaking of the clinical judgment model that we push so hard in the nursing program, that's what simulation is really about. But seeing the level 4 students that are about to graduate do so well and progress, just like you were saying, was really the moment that makes me proud of what we're doing here and gives me the fuel to keep doing what we're doing and keep growing as a program and what we're doing for our students.
So what is your favorite part of simulation personally?
Well, my favorite part, I think, is I really get into character, and I will make up backstories for the patients or sometimes their family members, and I have been known to do some funny voices to go along with the patient, and it makes it fun to me, and it makes the students laugh as well. But it really is helping in a way to prepare for some of the interesting things that they're going to see and hear as a nurse, because you never know what you're going to walk into in a real patient's room. And so those are kind of the enjoyable moments that make me laugh and that I have fun doing what we're doing.
And they make me laugh when I walk through, and some of the other instructors as we walk through and hear those things. We won't put you on the spot today, but maybe someday we can come back and you can actually get into character for us. We would like that. I think
that would be great.
I think that would be great.
Or folks can come by the Sim Lab and check us out.
Oh, that's even better. That's even...
see what we're up to over in the nursing
That's
building.
even better. Blake, we're so glad to have you on our team and so proud of the changes and improvements that you've already made for both our program and certainly for our students. We look forward to working with you to make our Sim Lab better than ever, better than it is now. Blake, thank you so much for being here today. We do appreciate all that you've done for the students in our program. And to learn more about the School of Nursing and Allied Health, go to hbu.edu/nursing.